We're going to pull item number 69 to the top. And before we get started, I want to acknowledge that you can't go anywhere without talking to your neighbor and seeing the news constantly about the coronavirus and how it's affecting this country and around the world. Daily, multiple times a day, people are asking me, and there's a lot of information. So I don't want to cover the washing your hands and doing all the fun stuff that's on over and over, but you have been doing a lot of work behind the scenes since day one when the plane almost came here to Ontario Airport, the first instance where we really touched home.
We start off this timeline in December of 2019 is when the first case of coronavirus was identified in China. Throughout January is when we saw our first confirmed death by the virus, but also our first confirmed case in the United States. As you had indicated, Mr. Chair, later in January is when we were notified of possibly a plane of 195 U.S. citizens being repatriated out of Wuhan to our Ontario airport. Despite the fact that we were all prepared for the party, they ultimately, a few days later, did redirect that plane to March Air Force Base. So folks, I think, are most interested in kind of, am I at risk for getting coronavirus or COVID-19? And quite honestly, and this is something that we keep trying to tell folks, is that for the general public, it is highly unlikely that you're going to be exposed to this virus. So for the general public, the risk continues to be low. Healthcare workers, obviously caring for patients with COVID-19 are at elevated risk. Those that have been in close contact with COVID-positive patients are at elevated risk. And then travelers returning from all of those international locations that are currently listed on the CDC website are also at elevated risk. So what is happening at the local level in terms of testing? We started testing at the local public health lab on Friday, March 6th. We actually performed tests for 3 priority cases that we had at that time. In fact, over the weekend, what my incredible lab staff were able to do is, because they were able to automate certain processes, and because of recent changes to specimen collection, we may be able to increase our original estimate on what our capacity is. We originally estimated between 10 to 15 on a daily basis. We may be able to increase that to 30. But what I want to point out, though, is that we placed another order for test kits over the weekend. It is unknown when those tests will come in. And so as a result, we are currently developing testing criteria. We want to make sure that for us to be able to test, we are really focusing on what we would consider, again, those high priority populations.
If you take a sample, how long before you know that sample?
We were able to have results in several hours.
Several hours. And does that mean if someone tests negative that they're clear, or you still have to do the wait 2 weeks segregation type of thing if you've been exposed?
For all indications, if they test negative, they are clear.
We have 3 levels of preparedness at Arrowhead. The first level is just getting ready, no cases. Second level is when we have suspected cases. And third is when there's a confirmed case with person-to-person transmission. Each of those scenarios have a lot of details behind them. Arrowhead has daily huddles with physicians and providers to update on all the CDC guidance and other factors in the county that will allow us to do a better job for our community. And with that, I'd like to turn it over to Dr. Kumanala.
We were also considering screening on outside of the hospital, and those would be, for example, perhaps screening patients in their automobile, screening the ambulance patients outside in the ambulance bay. Okay. And of course, following public health recommendations for discharge of patients, and then cohorting any patients suspected of having COVID-19 on that floor where we would have corrected the negative pressure environment. So that's our plan at the current time. Things are fluid, and we are adjusting. I will say that we've been here before when we had Ebola, and so this is a second time around for us. Things are functioning much smoother, and so I think we're well prepared.
Looking at the line of first defense, and that's our county employees, whether it be sheriff, fire, probation, whoever it may be, our different departments, whether it's child support, child protection services, whatever it is, that we have whether it's a guide or some kind of a line item checkoff list in which we have also prepared our employees who are exposed at whatever given time to the public, ensuring the fact that their health, their safety is one of our priorities relative to keeping the county operating and being able to address the public's concerns and ills by staying healthy. And I think that's very important. So I'm hoping there's something included here, because I am going to be looking for that. And I don't know what kind of training and or information needs to be shared or has already been shared with all of our departments.
Recognizing that the fire departments across the county are faced with identical challenges, with us being the first response, the first line of the individuals making contact with the patients in the field, we've been working very closely together to identify the things that we need to address to minimize those risks. Additionally, we identified some funds through AFG that were deobligated, about $70,000. We took that back to the state to see if we could get a regional approval to spend that money on personal protective equipment. One of the biggest things that's a shortage right now is the N100 masks. So those masks, what we were able to do is kind of harness our purchasing power there. With all of the county fire departments, we got approval to take this grant money and buy those masks for all the county fire departments. So they'll be disseminated amongst all of us. Essentially, we're just kind of identifying issues together and then trying to solve problems together, so we're maximizing our effectiveness. And then lastly, our EMS shop is putting together training bulletins. They're working in conjunction with ISMA, Public Health, CDC, to put together training bulletins, in service training, all of the information that is needed on what is a true exposure, how are we handling exposure, what's the next step we take once an employee is exposed, decon procedures, all of those things that are very important to make sure that our employees are not then taking that back into the fire station, to their homes, or into another county facility and perhaps infecting someone else.
The county is prepared and is doing a lot of different actions behind the scenes that we wanted our residents to know that if and whenever it reaches our borders, that we have a lot of things going on.